Good afternoon, Dr. Mark, Cedar Springs Chiropractic. I have one of my favorite patients today, Mr. Spine. And the question that we're going to cover today is frequently asked question number 4, and that is, do all patients receive the same adjustments? And so the answer to that is absolutely no. And again, we could have 100 patients that have absolutely 100 different structures of their spine and different areas they need to move. But what I want to do is kind of go through what are the 4 basic ways I will adjust somebody, and then explain how, even though they may appear to be the same, that within those 4 ways, there's many different varieties. So if Mr. Spine has a problem, let's say in his neck and his low back and pelvis, most of my clients, we're going to start them in a face down position, and that's called prone. And in this position, number 1, I could be using a drop piece to adjust his pelvis. We could use a drop piece to adjust the neck. And from this position, I can also ask Mr. Spine to turn his head to one side and give a very specific manual adjustment to any part of the neck. We can also give a manual adjustment to the thoracic spine. So that's the first position. Then we would sometimes bring Mr. Spine onto his side. And from this position, again, we could still use drop piece, or I could use some very specific manual corrections to his lower back. And lastly, we would put sometimes Mr. Spine on his back, and from this position, we could very precisely adjust his neck, his middle back, and we could also use drops through the pelvis. So within those 3 different positions, it's very important to remember that there's many different vertebrae in each part of the spine, and the direction, the location, and the amount of thrust I use will completely be different based on all of my clients and what their specific needs are. So no, we will not adjust everyone the same, and I hope that answers your question. Have a great day.